Approximately 1 in every 17 people may have chronic kidney disease. Of those, some will go on to develop renal failure, requiring long-term dialysis treatment or a kidney transplant. Although renal failure is relatively rare, treatment with dialysis or transplantation is very expensive, both financially and personally, and in many cases even a transplant is not a cure. We believe that we can improve the diagnosis, treatment and understanding of kidney disease and make the lives of thousands of people in the UK better.
In 1990, I went for a pre-employment medical for a job that I was going to go for, and I was told that, did I know I was losing protein at 40 times the average daily rate? Well, that was a complete shock to me. And when I asked what that meant, they came up with this wonderful line that if you lose protein, they're the biggest molecules. So it basically meant I had holes in my kidneys. I was in my early 30s. I felt completely fine. Never suspected anything was wrong at all. I remember sort of being told and sort of not being able to sleep and being sort of, absolutely shocked and quite tearful. It was an extremely unsettling time and very difficult to cope with. Something that people possibly need to be aware of is that often you can look really well and be in end-stage kidney failure. If I didn't know through my blood tests and my visits to the consultant how ill I was, I wouldn't actually realise. I would just think that I was getting older, I was getting a bit more tired, certain things were falling off through age. I fell under the care of Dr. Marsh. He told me that the good news was he actually knew what was wrong, and the bad news was there was no known cure. From then onwards, I knew that I was on a slippery slope, basically with a sort of level of decline every year, of losing between 3 and 4 points of kidney function each year, to a point where I would have to either be on dialysis or have a transplant, or probably have both. Personally, the illness I have will start up in a new kidney. It's carried in my blood, so I know that if I have my transplant, it's not a cure for life. It's maybe 5-6 years, and then the disease will have got rid of the new kidney. So I know that it's buying me time in a way, and that I hope that when I've done that, the advances in dialysis and everything will be that much greater, and it'll be that much easier to live on dialysis. You always end up going through, the very smart, beautiful buildings down to the one prefab post-wall building at the end of the site, and that's going to be the kidney unit. And you go in, and it's a real shock, and you see people in all sorts of states, and you can't imagine that that's, could be you. And the thing that's amazing is the people and the staff. In all the hospitals I've been to, the staff and the doctors and the nurses are absolutely wonderful. And kidney disease is not like breaking a leg. It's not something you'll go and get fixed and then you'll go skipping away. From the day you have your diagnosis, it's with you for life. And there isn't a day that doesn't go by when you aren't thinking about it. Your team around you and your nurses and your doctors become like a family to you, really, because you rely on them and you trust them and you ask them for advice. And that's where a lot of your personal attitude and positiveness comes from, is knowing that you've got those people there. If you didn't have that support team, I'm sure it would be much harder to be that positive about what was facing you, really.
Kidney disease is a huge challenge for the NHS because a lot of people who have it don't realise they do. The more you look for it, the more you realise it's affected a fair amount of people, and indeed, depending on how you classify kidney disease, close to 5% of the population may have it. Now, when you think about 60 million people in the UK, that's a fairly large number of people, a lot of who don't know they've got the problem. Another reason why it's a major challenge is, for conditions where you can get in early and treat, you have the chance of a cure. For conditions which are detected late, you've probably lost the chance of curing, but you're now into long-term treatment, and treating kidney disease isn't cheap. With regard to kidney disease, some of the most common causes relate to people with cardiovascular problems. Very often the people who have these conditions also have other conditions such as a history of heart attacks, poor circulation going to the legs. But another common group of people who tend to be affected are people with diabetes, because diabetes on its own affects the cardiovascular system, but also patients with diabetes tend also to have things like angina, probably poor circulation to the legs, and the kidney gets caught up in this. So in the UK, at least at the moment, between 30 and 50% of people who have chronic kidney disease have either diabetes or some other form of vascular disease. Not many people are aware of kidney disease in itself, but also the potential causes of kidney disease. And I think that is a big issue with regards to people maybe avoiding activities which could cause harm, or realizing when they've been exposed to it and then finding help. You can either give specific treatment. For instance, the patient's got an infection, so you treat that infection and expect the kidneys to improve as the patient improves. Or if you haven't found a specific cause, and this is the case in most of the patients, you give what's called supportive therapy. You cannot cure the condition, but you can make the symptoms better. Most of the population with kidney disease whose kidneys have failed to the point of needing help will be on dialysis of one form or another. Dialysis is seen as supportive therapy. A kidney transplant is much more than just supportive in that in some cases it is curative, but you probably have heard of people who've needed more than one kidney transplant, so if it was the answer, you wouldn't necessarily have had people needing further transplants. So you could also see it in some way as the best form of supportive therapy that we have. One of the other practical things people have to deal with is going on holiday, where before all you would have thought about is which destination should I go to and how much might it cost. You now have to add to that the realization, I will also need dialysis. Is there a dialysis unit close by? And that's one of the reasons why I think a fair amount of people on regular dialysis, hemodialysis at least, probably just don't book a holiday. The renal unit in St. Helier Hospital has been functioning since about the late 60s, early 70s, so it's one of the older renal units in the country. It's a large unit in that its catchment area, the people it serves, are close to between 1.5 and 2 million. You get to know the patients over a long period, you develop professional relationships with them, and this often leads, therefore, to you having a motivated group of patients who are able to say, I want to do something to help people with kidney disease. And when you start looking like that, you get the benefits of not just the medical and nursing profession, but people who have been affected by it and who bring a different perspective. And this is how we're then able to get ventures rather like the Southwest Thames Kidney Fund, which is developed at St. Helier, a beacon, if you like, for what can happen when doctors, nurses, and patients come to work together to tackle a problem. Here at St. Helier, the Southwest Thames Kidney Fund has set up the Institute of Renal Research. The hope is that in due course, the profile will be raised enough and hopefully we can begin to talk in terms of cure rather than hopelessness for kidney disease. One of the people who was very instrumental in helping to develop the Kidney Research Institute was a consultant kidney doctor called Michael Bending, and in partnership with another gentleman, Richard Salmons, and a few other people, they brought up a huge fundraising effort.
Well, this Southwest Thames Kidney Fund really came out following my appointment as the second nephrologist at St. Helier Hospital, Carshalton. And when I came to the interview here, I was horrified to see 7 or 8 other highly qualified young kidney doctors all vying to get this wonderful job. And at the interview, things seemed to be going very badly. And just as I was about to leave, the chairman leant over and said, "Is there anything you can do to improve the the outcome of this kidney unit? And I said, yes, sir, without even thinking. If you appoint me to this job, I will build a research institute. So that was the setting, and in 1984 or 1985, we set up a number of well-wishers of patients with kidney disease in southwest Thames. Many of them were patients themselves or relatives of patients, and we began collecting money. It took us about 12 years to raise nearly £1 million to build the institute that you've seen on this video. It is one of only 3 independent kidney research institutes in the United Kingdom, and this means that our scientists aren't focused on government targets, but they're free to range and roam anywhere within the confines of investigating and experimenting and developing new treatments and new ideas on the cause of diabetic kidney failure, looking at the long-term view. Blue sky research, we call this often. The stimulus that the Scientific Institute produces to young doctors and nurses and dietitians and paramedical staff is absolutely inestimable, and it allows them to widen their horizons from just focusing on the day-to-day needs and problems of patients, often who are desperately sick before the treatment has been successful, and it allows them to see the work that they're doing in the context of the bigger wider scientific world. And this can only be enormously beneficial to their own personal development. We've managed to attract many of the leading young aspiring nephrologists to come and work here just because of the institute that we've set up. And many of these young men and women are now consultants throughout the United Kingdom and even overseas. It does provide that extra clinical care, which allows us to provide 8 junior trainee nephrologists to the South Thames region. The real sense of pride and achievement is to see what nurses and doctors and technicians and scientific staff can achieve when they're totally backed by patients and relatives and friends. And it's the team effort that's so exciting and produces such enthusiasm. Well, the Kidney Fund needs to raise at least £400,000 a year, and that is just for the baseline running costs of the Institute. We do, of course, have considerable potential to expand that, and if and when more funds become available, we could readily take on an extra postdoc student and 1 or 2 more PhD students. The ambitions for the Kidney Fund are enormous, and we have reached a very critical point in our development. And up until now, nearly everything that we have done has been funded by goodwill and by donations and by fundraising projects, by patients and their families and by local organisations. Fundraising areas have been set up in Croydon and in Sutton and in Kingston and in Guildford and in Camberley, the main areas covered by our patient pool. And in the last year or two, we've been absolutely grateful to receive the fantastic support of Graham Morrow, who's the father of one of our young kidney transplant recipients. And Graham has really thrown himself into organising fundraising events across Surrey and has brought in a lot of extra new ideas to keep the coffers full.
Our involvement with the Kidney Fund started in 1991 when our second boy, Craig, was diagnosed with polycystic kidneys. This fitted in quite well with our lifestyle in as much as our eldest boy had been diagnosed with type 1 diabetes when he was 15 months old, and diabetes and kidney disease are both closely related. Our object is to try and retain 18 months to 2 years funding at today's level to ensure the continuity of the Institute. Our approach is to have as many different types of fundraising activity as possible. For this, we're very grateful to Anne Collard at the Institute for organising things like the Fire Walk, the auctions at the House of Lords, the Dragon Boat Race, which took place at Kingston. These are all one-off big hit activities, cannot be repeated regularly, but they give a boost to the funds which allows to continue. Our fundraising sources as far as the local branch is concerned primarily come from store collections. These take place over 1 or 2 days and require ideally 8 to 10 people to cover the hours necessary, but sometimes people are just not available at the time we need them. Some people who have been fortunate enough to receive transplants and are now well have the mindset that I'm better now, it doesn't matter. So it's not easy motivating people to collect money. We as a local branch aim to raise at least £1,000 a month to support the Institute. Out of 120 people, we probably have no more than a dozen who are active. Everyone receives the newsletter. Everyone can do a little. And if they did a little, those that are doing a lot can do a little bit more because they don't have to worry about the smaller pieces. We have less than 1% deduction from the money that is raised to that which goes over to the Institute. People, once they understand that everything they do goes to this source, then need to understand that it is every penny that counts. You don't have to organise something that will raise £1,000. A coffee morning that raises £20 over the 5,000 people that are receiving Renality is a lot of money. The important thing is to get involved. We need to know that we can continue for more than the 18 months funding that we have in reserve. Without money, we can't have research. Without research, we can't find a cure. And without a cure, we can't return people who've suffered from kidney disease and their families back to happy, normal lives.
You can find out more about the Research Institute in the other films on this DVD. To find out more about the Kidney Fund and to get involved with fundraising, visit our website at www.kidneyfund.org.uk. You can also call 0208 296 3698 or contact your local branch through our quarterly magazine, Renality.